Welcome to Channel 17, the Town of Colonie Government Channel.
Welcome to Parenting in the 21st Century. I'm Zina Shevchik. We have with us today Dr. Lawrence Kotlow, a well-known pediatric dentist from Albany. Thank you, Dr. Kotlow, for taking the time to come to talk to us about children's oral and dental health.
My pleasure.
The first thing I'd like you to talk to us about is when exactly parents should be thinking about taking care of their children's dental health and to whom they should go to take care of their children's health.
Well, it's interesting you ask that because science has shown today that dental disease is an infection. It's caused by bacteria, but we didn't know it's actually spread from the mother to the baby. And we have a lot of science to back this. Things that were done in the Scandinavian countries and some studies in this country now show that mother's oral health is very important in determining whether your baby will have good or bad oral health. It's very important for women who are going to get pregnant and during their pregnancy and after their pregnancy to make sure that their oral care is at the same level they want their children to be. If you have a mouthful of cavities, if you have gum disease, if you're not taking care of your teeth, you are going to spread those bacteria which cause decay to your child. And then 5 years later, you'll say, but I did everything right. Why does my child have decay? I didn't give him this. I don't give him candy. But the fact is, if your oral care is poor and your oral health is poor, not only will it affect your health, but it's going to affect your child. So when you take that spoon and put in the baby food and put it in your mouth and put it in the baby's mouth, if you pick up the pacifier and put it in your mouth and put it in the baby's mouth, if you're eating and sharing food with your baby, you are going to spread the oral disease that you may have to your child, and that's very important. When do we want to see children? Well, I like to see children as early as a year, no later than 6 months after the first tooth erupts into the mouth. Why so early? Well, one of the reasons is it's educational for you as a parent to know that you don't put a baby to bed with a bottle, you don't let them walk around with a sippy cup. If you're nursing, you don't at will nurse all night long without wiping the teeth off, because these are the major cause of early childhood tooth decay. The other thing is, I'll see kids at birth. I mean, I've been called off the golf course on a Sunday with a newborn who's one of my patients of other children in the family, who's tongue-tied. There are a lot of mothers who want to nurse, and they just can't do it. They get sore nipples, their milk is not being stimulated, the baby is nursing every 10 minutes and falling asleep, not gaining weight. And this is because the child is tongue-tied many times. And a simple in-office procedure that takes 20 seconds, maybe half a minute at the most, using a laser, no bleeding, no post-operative pain. I can take your child who's not nursing and grasping onto your nipple and immediately bring the baby back, and the baby can start nursing. So I've saved a lot of parents the heartache, because a lot of mothers get very upset because they really want to nurse. And they've been told, well, just give them a bottle if they can't nurse. Well, that's not the right answer. The right answer is get to someone who has a laser, can do it in the office. It's not invasive. There's no stitches and there's no pain. And it's the only procedure that I do that I say takes care of 3 people. Takes care of the baby, takes care of the mother, takes care of the father, because he doesn't have to hear the mother in pain and the baby screaming all night. So it's really one of the most good feeling type procedures as a dentist we can do, because it helps a lot of people in the house.
So at 6 months or a year is when you would normally want to start seeing a child?
First teeth usually erupt into the mouth about 6 months, okay, and they're usually the lower front teeth. Start brushing those or wiping them immediately, but usually at the 12-month birthday, that's when we want to see them. Now, I'll see them at any age. If you bring your baby at 6 months because you have questions, feel free to do that. But a year is a good time to start, because then we can talk about things you're doing right or wrong. We can talk about fluoride. We can talk about brushing. We can talk about flossing. We can talk about diet and things which are important to prevent the spread as well as the beginnings of dental disease in your child. It's really important for me to get that child starting out early, because most of what I do is on 3 and 4 and 5-year-olds who have done what we've just talked about, slept with a bottle or a sippy cup or nursed at will, and they come in with anywhere from 3, 4 to 20 teeth that are decayed.
I have 19-year-olds now, and they have beautiful smiles. And in the interest of full disclosure, I should say that you were their pediatric dentist. But I know it was a shock to me when I had my children, when my pediatrician recommended that they go to a dentist before they were 2 years old. In my generation, I had never heard of that. So this is quite something new, isn't it?
Well, I've seen kids since birth, since I've been in practice, and that's over 30 years.
30 years, okay.
But the reality is, it's only been recently that the American Dental Association, the American Academy of Pediatrics, and the U.S. Department of Public Health have recommended that we see children as early as a year. Surprisingly, in the year 2000, the Surgeon General suddenly discovered that tooth decay is an epidemic in this country. Us pediatric dentists, we've known that for eons, because we see kids, and we see the worst of the mouths many times, because there aren't enough of us to see every child. So what happens is, a lot of times it's when the second or third child starts to get a lot of decay that we get a referral in. Unless, say, someone like you who brought their first child, then they know to bring their second and third, and as many children they have, to the dentist. But it's real important, because the education aspect, just for the parents, we talk about pacifiers, we talk about thumb sucking. And the biggest cause of tooth decay today is children who sleep with a baby bottle, children who walk around with a sippy cup, in either case filled with sugary liquids. And they just rot the teeth out very quickly. And I'm trying to get legislation, and we can't get the bills out of the New York State Assembly and Senate, where all baby bottles manufactured that come into New York State would have a warning, just like on a package of cigarettes. Warning: allowing your baby to sleep with a baby bottle or walk around with a sippy cup as a pacifier can cause severe dental disease. Mothers who nurse, and they sleep all night with their baby, and at will nurse, and don't wipe off the teeth, also run a risk of tooth decay. So the 3 reasons that I am so busy is the milk bottle, nursing mothers who don't wipe the gums and teeth off and allow at will nursing, and the parents who use the sippy cup when they walk through cross gates or Colonie Center or in the back seat of the car on your vacation, and they leave that sugary liquid in there. Eventually they come in with 8, 10, as many as 20 teeth decayed, and it's not only painful for the child to go around like that, but it's expensive to restore it.
And from what I remember, it affects the child's permanent teeth as well. The coming in, am I right that when the baby teeth are affected, it affects their later dental health as well?
Think about what the function and the purpose of baby teeth are. From a standpoint, we're talking back and forth, and you're smiling. Okay, I see your teeth. If your teeth were all rotted, you would stand there like this. And children have an image of themselves also. And if they don't have a nice smile, they know it. So just from a psychological point, you need to have nice teeth, straight teeth. So when you smile, you don't feel self-conscious. We take the next step: you can't eat correctly. Children who have a lot of decay do not sleep, they do not eat, they're considered hyperactive. I've seen kids come into the office who are on medication for hyperactivity, and they have 5 or 6 abscessed teeth. And it's amazing, when we clear up their teeth, they sleep through the night, they eat better, they feel better, they have a better concentration, they do better in school. There are more days missed by parents from work and children from school because of tooth decay than any other illness.
How do you propose, well, I guess I'll back up there a little bit. I assume that most children see pediatricians. Is it that the pediatricians aren't informing parents, or the parents aren't listening? What do you think
Well, I think it's a combination of factors. There are still some pediatricians, as well as dentists, who haven't got the word yet that we need to see children at a year. And when you call up on the phone and your physician or your dentist says, well, we don't see 3-year-olds until they're older, or we're going to wait till your child is old enough to sit in a chair and be cooperative, even if they have some decay, we'll just wait, and if it becomes an emergency, we'll treat it. That's the wrong information. That's when parents, come into the office with their 3-year-old whose mouth is a disaster, and it takes a lot of time and energy and money to restore it, and they had gone someplace, and they were told it's just stain or they're just baby teeth. So we need everybody to be at the same point, and that is understanding, and I hate to be repetitious, but I need to, and that is dental disease is an infection. It's caused by bacteria. It is not self-limiting. If you have one cavity, it spreads to the second tooth. Baby teeth up against a permanent tooth, even if they're 10 years old and that baby tooth may be out in 6 months, if it's next to the permanent tooth, if this is the 6-year molar and this is the baby tooth, and there's some decay here, it's going to spread to that permanent molar. Parents sometimes don't even know that when a child is 6, they start to erupt their 6-year molars because they don't replace anything. And when you tell them that you have permanent teeth in there, they're surprised. Well, fortunately, they didn't have a difficult time teething, but they have their permanent teeth in it. The things we can do today to protect teeth, on the 1-year-old, we have fluoride varnishes. These are pleasant tasting, very tenacious, sticky stuff, which we can now put on the teeth as early as a year and help remineralize the teeth if there's any kind of decalcification. Fluoride, it is the most important and beneficial thing, and Colonie is not fluoridated. It's one of the towns around here who has not jumped on the bandwagon, such as Gilligan and Schenectady, where their kids have the benefit as well as the adults. We keep our teeth. We don't wear dentures. And when we're getting to our 60s and 70s, it used to be we all wore dentures. We're not going to have that. We keep our teeth a lifetime. But normally our gums recede no matter how well you take care of your teeth. And your roots start to get exposed, and you're going to start to see decay on those surfaces. And those people who've been in a fluoridated area are going to be more immune to disease than those adults. So it's not just for kids anymore. It's for adults too.
My kids, I think, took fluoride pills
Correct.
when they were young because we didn't have fluoridated water as well. Does
That's
that
right.
So that works as well?
That works as well. But along with fluoride, now we have fluoride toothpaste that are prescription. Now, when you get a cavity and it's just beginning to get into the enamel surface, whether it's an adult or a child, we can have that cavity remineralized if it's only just beginning. And we do that with fluoridated toothpastes, with something which I use called MI paste, which is a calcium phosphate supplement. And with fluoride, it helps bring calcium back into the tooth. And the third thing is we have a mouth rinse, which is a prescription, which reduces the bacterial content of the mouth. So as we look at a patient, we kind of analyze them and look at the experience that they're having, whether they're at high risk, whether they're at low risk, whether they're at a moderate risk, and we can determine which fluoride to give. This is something that's new. I brought it with me. It's called Spry. What it is, we have found that a sugar called xylitol, and you're finding that a lot of times in your sugarless gums, actually prevents the adhesion of the bacteria to the tooth. So if you want to train your baby to go to the toilet, you want to train kids to do things, it's a pleasant tasting little mint, and it is sweet, and it tastes good, but it prevents tooth decay. So instead of using M&Ms, go to the internet, look up Spry, S-P-R-Y, or call my office, we can give you the names, or go for the sugarless gums, but read on there. Make sure it has xylitol on it.
Spell that.
Xylitol.
Okay.
And very pleasant tasting. But you can use this to motivate the 3- and 4-year-olds if they're not toilet trained yet, without giving them something that's going to cause tooth decay.
Okay.
Or the teachers in school. A lot of times they'll give fruit snacks and fruit roll-ups out.
Right.
The next biggest cause of tooth decay are dried fruit. If you
No raisins.
If you give that dried fruit at 11 o'clock in the morning for a snack, and that child doesn't brush their teeth till, say, 8 o'clock at night, that means the acid in the mouth, because that's what the sugars produce, acid, is sitting there 8, 9, 10 hours.
Yeah.
And that's, parents say, well, I brush them in the morning, but it's too much of a thing to do at night. The nighttime brushing is the most important, because that's when all that junk food has been sitting on the teeth. And if you're going to give them fruit roll-ups and gummy snacks, brush and floss immediately afterwards.
And when do you start brushing the kids' teeth? You talked about babies, I assume rubbing the teeth and the gums. Does a 1-year-old accept usually if you do it the correct way? Do they accept actually brushing with a toothbrush?
Well, first of all, let's begin. Whether the child accepts it or not, it has to be done.
Okay.
So,
Well, you must have some psychology training here, so you must have some strategies to offer parents.
Okay, well, number one, we recommend massaging the gums, and you can buy a little finger cot with got little plastic vibrating fingers on there. And some people think that teething is actually gum disease. So if you go in, and this stuff is also made in a gel, the xylitol, and you put a little bit on a 2x2 gauze or something and massage the baby's gums around 5 and 6 months of age, so they're getting your fingers in their mouth. So you start real early, so at 3 you don't start brushing and have a fight with the child every day.
So they get used to
your fingers in the mouth.
Right, the fingers in the mouth and the whole.
And make it a game. Don't make it a punishment.
Make it fun.
Make it fun. And the xylitol is sweet, and they don't fight it. Okay, when they start to get teeth, you can use gauze or the same thing, or get a small toothbrush, and we have real small toothbrushes, and this is not even the smallest one we have, but we have small toothbrushes, and when you look at them, a lot of them are color-coded now. This blue area, you do not want to do with the commercials. 1 inch of a fluoridated toothpaste is a dose for a 3-year-old. So you want to use a small pea-sized amount of toothpaste.
So the color on there,
Right.
the blue,
Right.
is the amount of toothpaste you should, the
Right.
width of the toothpaste that you should put on.
Exactly.
Good.
And with all of the children's toothbrushes have a color right in the middle or at the end. So you're doing a small pea-sized amount. That's a green pea, not a lima bean. Okay.
Yeah.
And then initially, if they fight the toothpaste, and you want children's toothpaste, the adult stuff is pretty minty and it's kind of hot. So you get the children's toothpaste in there, and just a little bit to start with, and you can add more and more as you want to. And if they fight that, they don't like it, just use water. You want to get them clean, and then go back and introduce the toothpaste. And you want to stay away from a fluoridated toothpaste under the age of 6 months, and then just a little bit from 6 months on. And don't worry if your child swallows it, because you're only using that small pea-sized amount, so you're not going to cause any problem whether you're giving them fluoride or they're in a fluoridated area. Now, the other thing is parents don't understand is the easiest way to brush is to have the child actually stand in front of you and tip their head into your lap. Trying to get in from the front is real difficult.
So they're not facing you, they're facing
away. They're facing away from you, and their head tilts into your lap. Most kids, it's easy. They just sit there and you can brush and you can see in their mouth. Now, the next step is a child who fights you a little bit, okay? Maybe the 2-year-old who doesn't really kick and scream about it, but their hands are grabbing your hands. Well, you can put them between your knees and you can hold their arms with your knees gently. And again, it's not punishment. Yeah. And then if you have one of these kids who just screams and kicks and carries on, if you have a big beach towel, rub them up in the towel rather than having 2 people, one straddling the kid and one brushing, and that's really traumatic. Just wrap them up in a beach towel, and they'll give up after a few weeks of knowing it has to be done.
How about the electric toothbrushes? Is that good for kids? I know my one daughter really took to the electric or battery-powered toothbrush. It just made it simpler and easier for her, and that from when she found that, it was no longer a struggle to have her do it.
As long as you understand when you use the battery-powered toothbrushes or the electric, you still have to brush. You just can't put it in your mouth and say, okay, you do the work for me.
Okay.
Okay, the rotation of the brush helps remove the plaque and the debris. And then there's the ultrasonic ones, which I like personally better because they actually vibrate in there rather than rotate.
Okay.
But any of the electric toothbrushes motivate the children. And they're in kids, they're in characters from Disney and all the other characters. And the kids like to brush with, Sleeping Beauty or Dora the Explorer or whatever. So yeah, go ahead and I think, but under the supervision of the adult.
Always.
Always.
Would you talk a little bit about what your office is like? Because I know my children always enjoyed going to your office because of its setup. So maybe if you can explain what makes your pediatric dentist practice a little bit different from what might be a family or an adult dentist practice.
Well, first of all, keep in mind that when you go to an adult dentist and you sit in the adult chair, I call it the Alice in Wonderland effect. You're sitting in this huge chair and you're about that tall. First of all, there's no access to the patient. You're bending over the chair. It's uncomfortable for you and it's uncomfortable for the child. And all the chairs in the office are geared towards children. But when you come in upstairs, we have a video going all the day. talking about oral hygiene, trying to educate parents subliminally so that, even if they don't concentrate, they hear it. I have a train that goes around the ceiling. We have a merry-go-round that doesn't spin, but the kids can ride on it. We have a fish tank. Things which the kids can play in video games.
Is that monkey still there? Was that?
All
I
the monkeys
remember
are
a
still
big
there,
monkey
and yes.
hanging from the ceiling.
And I try very carefully, to the best of my ability, if you have an appointment at 9 o'clock in the morning, you're seen at 9 o'clock. So we like our patients to be there early. We don't like the kids to spend a lot of time in the reception area waiting for us to get down, because that's the stressful part of going to the dentist. We bring them downstairs. This is a raised ranch, not the ideal thing, but that's what was available, and it works for me. We do have video games downstairs, and again, we have all the kids in one room, so that usually there's 2 or 3 kids being treated by 3 hygienists. We also have the most up-to-date technology. One of the biggest concerns parents have is radiation, taking x-rays. And, I don't blame them, but think about this. If you take a trip from New York to California, you've got more radiation in that plane than you're going to get from, I think, 5 or 6 of the panoramic x-rays. So what we do is very safe. But I've switched all of my x-rays to what are known as digital. And depending on the settings you use, that reduces the amount of radiation your child gets from conventional x-rays up to 90%. So I've invested heavily in protecting my children, my patients, to reduce their exposure to radiation. I also have lasers and diode which diagnose tooth decay without x-rays. So on some of these young children who we can't get x-rays on, I can use a laser or a diode and on the tooth, and it will signal me that there's decay there. And it's about 90% effective. It's being perfected. So, and I picked up a lot of kids with real small cavities, which we had let go, if we had let go 6 months, could have become a large cavity. The other things we do is we spend a half an hour with each child and above the age of 3, showing them how to brush and use dental floss. But those children below 3, 1 and even younger, you come in and there's a room about the size of this table. Actually, our knees are touching, and we call it a knee-to-knee exam. And you actually hold the baby's hands and legs so they don't struggle. And I have an overhead mirror, light in my mirrors, and we can do a pretty good examination in the little room. And if everything is fine, we don't have to see them in our operatories. If they have a lot of decay, then we would sedate them in the office, and we would do most of the work in 1 or 2 visits, rather than stringing it out 6, 7, and 8 visits, which really can traumatize some kids. They may not like 1 or 2 visits, but it's better than 10 visits to do the work. Plus, it's sort of like the little boy with the leaky dam. You plug 1 hole here and 1 hole here, you keep getting bigger and bigger. So if it takes 6 months to fill your kid's teeth, you're starting all over again, because we do want to see the children every 6 months. Now, I've also invested very heavily in lasers. Lasers have been available since 1999. I am certified by the Academy of Laser Dentistry in using lasers, and I'm one of 25 people who actually teaches and certifies other dentists in the use of lasers. And we have 7 different lasers in the office. We have 1 laser, which is the only laser that can cut teeth and bone. It's called an erbium laser. And we can do probably 75% of the fillings today that are small with a laser, which eliminates needles and drills and numbing. Okay, the biggest problem we used to have is the kids would bite their lip and come in with a swollen face looking like they've been in a heavyweight fight. But we don't need to do that in many, many cases. Now, like everything, it's not 100%. There are some children who come in with big cavities, and we need to cap their teeth with silver crowns and white crowns, and they still have to be numb. There are some kids we need to treat the nerves of the teeth, and in many cases we still have to numb them. So depending upon the degree of decay and the type of decay, we can either eliminate or postpone the need for local anesthesia in a lot of these kids. I have lasers we use for surgery. I don't have scalpels in the office. So a lot of these procedures, tongue ties, frenectomies, even biopsies, canker sores, herpes, we can treat with a laser, not in the operating room, in seconds. You get these fever blisters, well, we can put a laser on there and abort it and stop it from happening, and some cases never come back again. Kids who come in with full-blown viruses in their mouth, we can put it on their cheeks and reduce the time that they're going to have it. I've seen children who've fallen, and usually in 6 to 8 weeks after you fall, your teeth turn dark. That means the tooth has died, and it can't be just watched. It needs to be treated. But if I get the kids within a day, it's a great laser. It doesn't hurt. It's a low-level laser. We call it photobiostimulating lasers. It works at the level of the mitochondria within the cell, and I can give you a whole lecture on that, but I'll skip that today. But it reverses the inflammatory process, and it prevents the nerve from dying in many cases. Okay. So there's wonderful things we have out there to make the experience of going to the dentist less scary. And then those kids that no matter what we do that are going to be behavior problems and need sedation, we can do that in the office.
Safely.
Safely.
Right.
I mean, using the same stuff for the last 30 years, and as I tell parents, laughing gas is another example. That works great, and parents are concerned about it. Well, in hospitals where they take everything apart, sometimes they can cross the tubing. But if our first patient survived 30 years ago, everybody's safe, because we don't change the hookups in the walls.
If it ain't broke, don't fix it, right?
That's right.
Now, I want to ask a tough question, which is, in your experience, do most health insurances pay for a lot of this?
Health insurance, in most cases, is taken by the parents through their job, and it's meant to help the parents. If the kids are there and get services, that's fine. But if you call the insurance company, they say, well, it's for the employee, not for the kid. However, most insurance companies will pay up to 50 to 80%, in some cases 100% of what we do. There are some insurance companies that don't pay very much. There are two in this area state employees have, the CSEA and the GHI, which are not very good coverage, and really in many cases they'll cover 50%. In some cases they don't cover anything. But other insurance companies cover pretty good. People who have Child Health Plus, which is really what they did about 8 years ago, is they took those people under Medicaid and they cropped off the top, say 30%, and to put them into Child Health Plus, which you don't deal with the Medicaid, you deal with the insurance company, and their fees are different than the Medicaid fees. Access to the Medicaid patient is limited because basically a state program, which the efficiency and the way it's run is pretty poor and creates a lot of problems in dental offices. And you know, those of us who used to take it have just gotten out of it because it was more of a headache. But a lot of us take Child Health Plus, and that gives pretty good coverage to a significant number of children who otherwise wouldn't have coverage.
And as with other kinds of health insurance, you know, early intervention just protects you from future problems and future costs. So, I mean, it's always, to me, as a parent, it was worth whatever it cost to take care of the problem with preventative care first, which would stop any future problems as well. So, I mean, it's a generalized problem with insurance in our country not paying for preventative care.
Well, so the real problem is not so much that they don't pay it, they'll pay the wrong way. I had a child recently who had a dental infection. And if you've read the papers, you heard there were 2 cases this past year of children who couldn't get care or postponed care who actually died from a dental abscess because the infection got systemic and actually ended up causing their death. And that just shows dental disease, if not treated, can be as detrimental to your health as any other thing. And the fact is, dental disease in adults, in women who have poor oral care, they're at a higher risk to having low birth weight babies or to actually have spontaneous abortions. Adults are of a greater risk with periodontal disease for heart attacks.
Yeah, I do know that. I have heard that one. That one's because what people talk about in the news, they talk about heart disease, high cholesterol, and they do talk about dental health as being a predictor, one of the predictors of heart health.
So it's really, really important to have good oral health, because by having good oral health, you can have a good general health in your adult years. The other thing which we didn't talk about is something called sealants.
Yes, and I know at least one, maybe both my daughters had it.
Well, the insurance companies will pay for them on the 6-year molars and the 12-year molars. But here again, it doesn't make sense. Sometimes they cut it off at 14 years of age, and some kids don't cut their 12-year molars till they're 15. Oh. So it's not an age-dependent thing. None of them cover on their primary teeth, which are just as important, which again doesn't make sense. But sealants are a coating, sort of like what you do to your driveway to protect it. Okay, we put a coating on the biting surfaces. It won't protect, the fluoride protects the surfaces of the teeth that abut the smooth surfaces, and the sealants protect the biting surface. And if you think of the biting surface as grooved, they have real deep or shallow valleys. The shallow valleys, the bristles of the brush can get right in there. But if they're deep caverns, these bristles can't get in there, and what happens is you pack food in there and eventually it turns to disease.
How often do you have is this a one-time thing, the sealants?
Sealants depends on your diet and whether you grind a lot. They are just plastic. And the sealants can last 3 to 5 years, maybe longer. So our parents come in and they prefer to have the white fillings put in because they look nicer.
Yes.
But there are a lot of kids who the silver, which does contain some mercury, but it's bound up, are much better in some instances because they're stronger and they work better. And there's no science out there that says that they're not safe. And all the studies show that it's safe. In small, incipient lesions, in kids whose mouths are relatively clean, on biting surfaces, the white fillings will work fine. But we either end up on these big, massive cavities, either covering the tooth, what we call stainless steel, or in some cases we have to use the alloys.
We only have another minute or so. I would like you to tell people how to contact your office, and I know you have a website, so perhaps you could tell us the address of that website as well. And in a few succinct words, what would you like parents to know most, what they don't know or what they should know?
Well, a lot of information is on my website, and it's kidsteeth.com. That's KIDDSTEETH. It's kids with 2 Ds, kids dentist, kidsteeth.com. And that has all of the information we talked about here. If they want to email me, they can email me at kidsteeth@aol.com. I think that parents have to know that dental disease is preventable and that when it starts, it needs to be taken care of. What I would like every parent to understand is get their kids to the dentist early, by a year. Don't put them to bed with a bottle. Don't have them at will nurse and not clean off the teeth. Don't use a sippy cup as a pacifier. Make sure they have proper fluoride and brush and floss when appropriate. And make sure your oral health is at the same level you want their children's oral health to be. And if we do that, you're not going to put me out of business, okay? I would prefer to just have happy kids with healthy smiles. To me, it's a failure when I send a child out of my office at 16 or 17 and they have any fillings, because that means they haven't learned somewhere there was a communication gap. We didn't get them to listen to do what we want. So if we can get them to do all the things that they're supposed to do when they leave our office, if it's not an accident or trauma or something that's congenital, we need to take care of them. And this goes for kids that have disabilities. You know, I don't want to see the autistic child when they're 13 because no one can treat them. We want to see them when they're 1, 2, or 3 when they're diagnosed. And don't say, I have so many problems with my child because they have heart disease or they're autistic. And leave the teeth to last, because eventually that becomes the major problem and getting care becomes a real difficult thing for many parents, or they have to travel 2 or 3 hours. I've had parents fly as far as Kentucky. I have a parent who flew up from Nashville, Tennessee on a Sunday for me to treat the child on a Monday and flew back because they couldn't get any care. So we do have parents traveling to pediatric dentists large distances because they've allowed things to go to the point where general dentists can't or don't want to treat it.
Thank you so much for coming, Dr. Kotlow. Obviously, we could keep on this conversation for a lot longer, and maybe at some point we'll have you back, and I appreciate all the information you've given to the parents who are listening today.
It's my pleasure, and as many times as you want, I'll be glad to come back and talk.
Thank you very much. Thank you for watching Parenting in the 21st Century.